Hi everybody and welcome back to my YouTube channel. I am your women's pelvic health physiotherapist and exercise specialist, Sarah Thorne, and this is the Pelvic Floor Clinic. This is where we talk all things pelvic health, exercise, recovery, pelvic floor dysfunctions, and it is my job to give you the information, the education, and give you the empowerment and the confidence how to treat your pelvic health. So today we are talking about pelvic floor tightness, but just a reminder, if you haven't already, make sure you subscribe to my channel, okay? Every week I release new videos on different topics and I want to hear from you. So leave me a comment if there is something specific you want to see. So what is pelvic floor tightness? Well, it's exactly what it sounds like. Most women don't know that as well as having pelvic floor muscles that are weak, you can have pelvic floor muscles that are too tight or they are too switched on and strong. Unfortunately, I don't really know why, but we tend to just not know about our pelvic floor health in general. And most times we tend to hear and focus about pelvic floor muscles that are too weak. However, many women will be experiencing a lot of the same and common symptoms of pelvic floor weakness, but instead they are muscles that actually are too tight and too switched on. So if you don't already know, your pelvic floor muscles are muscles that sit in your pelvis. They are a group of muscles and it is their job to support your pelvic organs, your bladder, your uterus, and your bowel. As well as that, they work as part of a cylinder. So this cylinder is our body, okay? We have our pelvic floor muscles at the bottom. We have our diaphragm at the top. We have our back and we have our core muscles. And together, these pelvic floor muscles play an important role with stability, with support for our body. So a lot of people and anyone really can experience pelvic floor tightness. Some of the symptoms include pelvic pain, pain when you're having sex, struggling to be able to keep a tampon in, problems with your back, problems with leakage. If you know anything about pelvic floor dysfunction, that is something that isn't going quite well within the pelvis or working well, or you know symptoms of pelvic floor weakness, prolapse, leakage, pelvic pain, back pain, then actually you'll hear that it's a lot of the same common symptoms. You don't have to have had children in order to have pelvic floor tightness. Many young athletes, many high functioning athletes of any age who are used to being abdominally strong can experience pelvic floor tightness. And really, it's all about recognizing what is happening in your body so that we can help you to get the help you need, the treatment you need, and to be able to relieve and reduce your symptoms. So if you are watching this video and you think, well, I have pelvic pain. Actually, I'm one of those people that holds my tummy in all the time. I struggle to keep a tampon in, or I leak when I'm exercising, or I'm a CrossFitter, or I have discomfort during sex. What can you do? Well, you can firstly know and recognize what's going on with your body. Identification of any issue is always key to treating and preventing it from decreasing and getting worse in the future. You can see a pelvic floor physiotherapist like me. It's our job. We work in private clinics as well in hospitals, and you can come and see us and we can assess you individually, internally, externally, and we can provide you with an up-to-date examination and assessment of what's going on with your body. Other things that you can do is really trying to work on calming down the things you do to create that increased tension. So, what are the things that you can do on an everyday life? Well, if you are somebody that holds their tummy in, it's really important that you try to work on breathing and releasing your pelvic floor. Instead of your pelvic floor being too weak, it's actually too tight. So part of that is taking and doing regular exercises like deep breathing exercises where you work on taking big breaths in and allowing your pelvic floor muscles to relax so that you can actually learn what's a relaxed pelvic floor muscle or a muscle that's staying on and staying overactive. Doing stretches that work on releasing your whole body, but in particular your back, your groin, your pelvis, are great ways to help calm down your tight pelvic floor muscles. Other things that you can do are making sure that when you are training, that you are making sure that you are breathing well. If you are somebody that holds their breath or you are a gripper, you're going to find that you're always tensing. And again, this is going to contribute to having those overactive muscles staying really switched on. If you are experiencing discomfort when you are being intimate with your partner, then there are lots of accessories and tools that we can use to help release the muscles. Also, by having pelvic floor physiotherapy, we can actually do manual therapy to help you work on releasing those muscles. So, as I've said, identification is key. There are lots of signs and symptoms very similar to pelvic floor weakness. So when you look at you as an individual, the things and the activities that you do, and when you're experiencing your discomfort or symptoms, that's going to help you to work out whether you may have a pelvic floor weakness or a pelvic floor tightness. Working on calming down our central nervous system and working on calming down our pelvic floor muscles is key. I am somebody that also has an overactive pelvic floor. So for me, one of the big things I try and do on a day-to-day basis is take a regular minute or two in my day where I just work on releasing the tension. I'm also an abdominal gripper because of my history with sport and exercise. So I really have to work on, when I'm standing still, to work on just letting go of my tummy. Okay, so these are just some of the signs and symptoms of a pelvic floor that is working too much. And I'm hoping that you have found this video really, really helpful. If you have, make sure that you give it a thumbs up, make sure that you subscribe, and comment if you have any specific questions. And watch out for my next video where I will be taking you through a guided stretching workout that will work and focus on calming down those tight pelvic floor muscles.